What's up, YouTube? What's poppin', y'all? Welcome back to our channel. If this is your first time here, thank you for clicking on our video and coming to our channel. Come to check us out. So, as you guys have seen by the title, this video is going to be a follow-up video about Alayah's appointment when she went to go see the doctor. She went to see the radiologist and she had a TCD done. Now, a TCD is a transcranial Doppler ultrasound, and she gets them done because she has sickle cell, and she gets them done because they do it to monitor the activity in the vessels and the brain and the veins and the blood flow and stuff like that. Because
all the time.
sickle cell patients can suffer from strokes, and they can have silent strokes, which are like undetectable strokes. So those testings do, like, they look deeper down to see what's going on with the brain and stuff, the veins in the brain and stuff like that. So she went and she got a TCD done in November of 2021. So she got it done at the end of last year. Those results, when they came back, those results came back abnormal. So because of that, her doctor wants her to now get an MRI. And now I'm going to explain the results of the TCD with what they told me. Now, basically, they explained to me that, so there's an artery that they saw that they don't know if she was born with it or if there's been damage and another artery grew in place of the damage. So the next step is to figure out if in fact she's had some damage going on, or if she was born with this extra artery. Now, my thing is, this is not the first time that she's had a TCD, so would you guys not have seen it previously? I don't know. But anyway, so her test results came back abnormal for that. So now she has to get an MRI. Now, getting an MRI for a child with sickle cell disease that's a whole nother situation in itself. Now, what they told me was that she would need to be sedated because the MRI is going to take about an hour to do, and she needs to be like perfectly still, like perfectly still, so they want her to be sedated. However, her with her having to be sedated, it could actually bring on sickle cell crises. And so far, my baby's she's only had one crisis, and I like to think that it's because I do my job and I do what I need to do to maintain my baby's health. I make sure she's good. Like I said in another video, I repeat myself. I don't care who gets tired of me repeating myself. When it comes to my child, I'm going to repeat myself over and over and over. I'm going to keep doing it. I don't care who gets tired of me saying, oh, okay, you said that already. I'm going to say it again. Now, so having the MRI could bring on complications. Now, that was like, what? Like, I don't want to do that. Like, okay, how can we get around that? And she said that the doctor basically said that we could try to do it without the sedation, but she would just have to be still. And if she could not be still, then we would have to do it with the sedation. Now, with her having sickle cell, in order to get the MRI done, if she cannot be still and they need to do the sedation, we will have to go to the hospital the night before. She will have to spend the night. They would give her fluids so that she doesn't become hydrated, and she may or may not need a transfusion. It just depends on her blood levels at the time. So they said, it could bring on sickling if she had to get the sedation. It could bring on sickling, but it might not, but it could. And I'm just like, I don't want to take that chance. So we're going to do her MRI without the sedation. Hopefully she can be still, because I would hate for her to have to get the sedation and do all this, and then the MRI comes back that it was something normal, but she get the sedation done and now she's having complications. Like, I would hate for that to happen like that. Like, I don't want to do it like that. So we're gonna try to do the MRI without her having to be sedated, because I just don't want to. I don't want it. Sometimes I might not be able to get around whatever needs to be done, but however, we're gonna try this other way first. We're gonna try without no sedation first. If she cannot be still, then we'll try it with the sedation. That's pretty much where we're at now. So I'm guessing after she gets the MRI done, once we figure out if it's something that she was born with or if it was something that's been damaged, we'll go from there. But that is what happened. The results to her TCD came back abnormal, so now she has to get an MRI done.
What is wrong with him? He is crazy.
So yeah, I'm just making this video because this is what happened with my daughter, and I want, you know, if you have children and they're gonna be going through this, what possibly, you know, is what could happen, you know, what might happen. So that's what might happen. You know, if your child gets a TCD done and it comes back abnormal, then they have to go to the next step, which is an MRI. Now, if your baby's too young, they're gonna make you, I'm pretty sure that they're gonna make the baby have to get sedated if the baby's too young. But, you know, they were saying that she's old enough, she might be able to lay still. So I'm just hoping that she will be able to lay still. You gonna be able to lay still? I hope so, because I don't want to do all that extra stuff. So hopefully she'll be able to lay still, and we won't have to go through that whole sedation situation and possibly trigger complications. Yeah, but yeah, I just wanted to put a little video of that out really quick, because I know that I made the TCD video, and now that we have her results, I wanted to share the results, and I wanted to share what's going to happen next. So if you ever find yourself in a situation like this, then you know, pretty much know what's going to happen. You're pretty much going to know what's going to happen next and stuff. So once we get the MRI done and everything, I will be letting you guys in on what's going on with Alayah. Y'all already know that I will be documenting my baby's whole entire journey. Once she get old enough, she probably gonna take the camera over, but that's what we're gonna do. So I just want to make these videos for informational purposes, just because I want to. I just want to share, you know, the knowledge. I want to spread awareness about sickle cell disease, and I want to spread as much information as possible. And seeing as how I have a child with the disease and I know about it and I'm learning about it, I feel like that I can share that stuff. Like, I can share the information that I'm learning, and I can possibly help, you know, like I said, parents that maybe have children that are smaller than my baby and they need more information. And, you know, you can read the books and read the pamphlets, and still sometimes if you had somebody that's actually going through it, you know what I'm saying, and have been through it, then they can maybe explain a little bit more about it, you know what I'm saying? So that's just what I'm doing, you guys. That's what I'm doing, and that's what I'm going to continue to do. But I will keep you guys posted on my baby's results. When Alayah gets her MRI results, I will let you guys know what's going on. It was the next step. And yeah, so you guys just stay posted. You guys can check out more videos on sickle cell disease. I do have a whole playlist. It's called Sickle Cell in Me. It's Alayah's playlist. It's her playlist. Everything's about her and sickle cell disease. So you guys, thanks for watching the video. Please go ahead and subscribe to the channel so that you guys can see the rest of the information that's going to come out. Click on the notification bell so you can be notified when we do post a video. If the sickle cell videos is something that, you know, you want to see, click the notification bell. So whenever I post a video about sickle cell, you'll get notified that I'm posting videos. There's so many more videos coming, okay? If you would like to check out our other fun content, then go ahead and check it out. And you guys, we are a growing channel, and we're going to be around. we're gonna be around. But thank you guys for watching the video. And we will see you in the next video.